Day class. In this video, we are going to continue the discussion on the selections of acupoints. There are two principles that we can follow according to the location and according to the meridians. According to the location, there are different principles or different techniques that we can think about. The first one is according to the local location. So for example, something related to the head, we can use the points around the head. Something related to the stomach, we can use the points around the abdomen, or more specifically, around the stomach. We also can use the other method, the combination of the upper and lower body. For example, for toothache, we can use large intestine 4. We can use stomach 44, as you can see here. The toothache in the upper part of the body, we can choose the lower part of the body or in the hand. Large intestine 4, also we can choose stomach, Yangmi meridian, because the Yangmi meridian travels through the teeth. Chest tightness, we can use pericardium 6. We can use spleen 4. This spleen 4 is on the feet. Anterior and posterior methods. Stomach ache, we can use Rome 12. In the meantime, we can use stomach 21, bladder 21, do 8. So these are something in the front part of the body, also some points on the back. On the back, also similar location to the stomach. So there's some points you can choose on anterior and posterior. Left and right method. Facial disorder, sometimes we can choose stomach 4, stomach 6, and then we use large intestine 4, large intestine 10 of the other part of the body, or of the other side of the body. For example, a patient suffers from the facial disorder on the left side. Then I'm going to use the points on the left side, stomach 4 to stomach 6, or individually. And then I'm going to use the points on the right side. So from the left side problem, I'm going to use the right side, large intestine 4 and large intestine 10. These are the left and right body technique. The 3 region methods, localized, proximal, and distal. For example, the eyes problem, I can choose bladder 1, the local points, GB20 and GB37. GB20, something related to the wind. GB37, from the name Guangming, which says brightness. This can be used for the eyes problem. So these are according to the location. These some principles that you can think about. According to the meridian, this can be from the meridian differentiation. So that's from your self-study. 少阳 headache on the side of the head, such as a migraine. You can use GB8, GB20, GB41, GB44 from the 少阳 meridian, gallbladder. You also can use the coupled meridian. When a patient suffers from liver problem, you can use liver 14, 奇门. You also can add GB34 from the gallbladder. That's the coupled meridian. The meridian with the same names, such as the neck, acute muscle strain, 太阳. You can use the hand 太阳 meridian or the foot 太阳 meridian. The reason for this technique is because the same names meridians, they have similar qi and blood in the meridian. 三焦 3, blood 60. 三焦, the hand 太阳, 三焦 meridian, the foot 太阳 bladder meridian. So that's how we select. We also can apply the mother and sun meridian. Mother and the sun meridians, that's according to the 5 elements. Level 3, level 2, and then you use hot 7, hot 9, hot 8. So the fire, the wood and the fire. The wood is the mother, the fire, the hot is the fire, that's the sun. The connecting meridians. The connecting meridians, we're going to focus on the connecting points. So this you can refer to your textbook, the table there. It either can be 2 meridians or even 3 meridians. They cross each other on some points, such as the splitting 6. You can choose those points for all symptoms or pathogenesis that are related to all 3 meridians. In one prescriptions, what need to be included in the prescriptions? Firstly, is how the acupoints that we're going to use. The acupoints that we are going to use, similar to the formula, we're going to select the main acupoints. We're going to select the assistance acupoints, which means in one prescriptions, you need to have something dominant. You also need to have some points that can support the dominant points. In order to determine the main points, the dominant points, you need to identify the dominant cause. So the main points is to be used for the main cause, the root cause, or the most acute symptoms that you want to relieve, the dominant conflicts of that situation. You're going to include the treatment techniques such as Moxibustion, acupuncture, needling, cupping. You also need to include the technique, the manipulation techniques, reinforcing, reducing, how long you're going to apply, what's the frequency of the treatments, the course of the treatments. So all these aspects you need to include in a prescription. When we formulate a prescription, we always need to think about these aspects, such as the selection of the points, the order, the application order. Do you want to apply which points first? You want to apply acupuncture first or Moxibustion followed by the Moxibustion, or do you want to apply Moxibustion first followed by acupuncture? You want to apply the reinforcing technique first, followed by the reducing, or the reducing followed by reinforcing. So all these aspects you need to think about, and when you think about these, you need to provide valid arguments. These arguments will be from your theory, from the explanation of the theory. For example, a patient suffers from asthma, an excess syndrome. You can prescribe Rung 17, Lung 7, Bladder 13, Lung 5. The reason for Rung 17 is the local points. This is also asthma. The patient suffers from tachypnea, the difficulty breathing, something related to qi. The Rung 7 is the gathering points of qi. Qi gathered at Rung 7. So I can use Rung 7, Lung 7, Lung 5. These are points on the lung meridians. The lung meridian, you also can think about the different categories of these two. Bladder 13, 肺腧, is the back-through points of the lung. With the excess cold wind and cold, we can remove lung 7, we can add lung 12, 风门. When you see the 风 means the wind. So if patient suffer from wind, we can use 风门. In the meantime, I also can use Moxibustion on these points, on bladder 12 and bladder 13. With phlegm heat, the patient suffers from phlegm and heat, so the patient will present as coughing with yellow phlegm. I can remove lung 7, I can add stomach 40. Stomach 40 we have emphasized a few times. Stomach 40 is very useful for clearing the phlegm. This phlegm, no matter the physical phlegm or invisible phlegm, you can always use stomach 40. The acute attack, you can remove the bladder 13. Bladder 13 is the backshore points. The backshore points can strengthen the lungs function. That's for the root cause, the lung deficiency. Although this is an excess syndrome, but the root cause is the deficiency of the lung. You can add the lung 6 in the acute stage. 孔坠 is the C-clef points of the lung. So in this situation, for asthma, we can use the basic prescriptions. You can think about these points, and then you can adjust the points from different causes. So you will select different points. When to apply the treatment? It also depends on the situation. Insomnia, you can apply in the afternoon or evening is even better, especially 1 to 2 hours before sleeping. But sometimes it's impractical. It is not possible because the patient won't come to you early evening. The irregular menstruation 3 to 5 days before the period, till the last day of the period. Infertilities during the it can be that you can do the acupuncture during the ovulation. You also can do the acupuncture during the cycle. So it depends on specific condition. We're going to discuss this more in detail when we study the infertility. For insomnia, although sometimes it is not possible to see patients 1 or 2 hours before their sleep, what can you do? You can teach the patient to massage on specific points. So when they massage, they can use their thumbs to massage. No treatments during the menstruation cycle. So if this patient is not for the menstruation problem, when you say menstruation problem, such as especially the lack of blood, the lack of volume of the blood during the cycle, if the menstruation only comes for 1 day, or spotting, or the excess bleeding, then you will treat the patient during the cycle. But if not for menstruation problems, during the menstruation cycles, we will stop the treatments. How long each treatment should last? Normally, it should last for 30 minutes. You can manipulate every 5 to 10 minutes. So this is the manipulation technique. You also can apply the electrical acupuncture. For kids or sparrow, you don't have to keep the needle for such a long time. You can remove the needle directly after insertion, after your manipulation technique. For acute pain, you can even keep longer, 1 to 2 hours, even more than 10 hours. Sometimes you also can, for example, the wrist and ankle needling technique. You can keep the needle for 24 hours. The reason why we use 30 minutes is because from the theory from Nanjing, explanation of 黄帝内经 Nanjing. It describes that the cycle of the qi and blood movements from the body, from the lung meridian, goes all the way to the other meridian, back to the lung meridian. The one cycle is about 28 minutes. So during our treatments, we keep for one full cycle. It described in Nanjing that we describe that the qi travels through the meridians during the day 25 times, during the night also 25 times. So which means in one day and night 50 times per day. When you divide 24 hours to 50 times, it's about 28 minutes. So we keep for one cycle. That's why during the treatments, we keep about 30 minutes for each patient. Just in general. The course of the treatment will depend on the disease. Most diseases can be 10 to 14 days, such as the Bell's palsy, the B-pen syndromes we're going to introduce in the disease. This refers to different kinds of pain of the muscle, mostly depends on the body related to the muscles and the joints. The course consists of 10 days. Some acute condition can be a shorter period. Some chronic diseases may be much longer, 1 month or even 3 months. The frequency is very important. For chronic diseases, you can apply the treatment every day or every second day. For the acute situation, you can apply twice a day or even every 5 to 6 hours. You can have a break between each course. So when you see the frequency of the treatments, this is very important. That's also why sometimes you see acupuncture doesn't work that well. It's because you don't keep the frequency. The frequency is very important, as this is very similar to the dose of the tablets. When you take the tablets, you take today. The second day you need to take again. The third day you need to take again. That's the frequency. So sometimes acupuncture actually doesn't work that well if you only see patients once a week or once in 2 weeks, or sometimes they also convince that you can see an acupuncturist once a month. That doesn't really work that well. The frequency of the treatment is very important. The time when the patient comes to you is very important, especially this condition related to the nerves, such as the stroke rehabilitation. The Bell's palsy, the time and the frequency is very important. In the acute stage, I will require patients to come every day, at least once a day in the acute stage. In this situation, the patient may gain the best results out of the treatments. Especially for Bell's palsy, you can see the improvements in a few. You can see the recovery in a few weeks. For stroke rehabilitation, sometimes you can see the improvements every day if you apply the treatments, the correct frequency. So for stroke rehabilitation, especially in the acute stage, you should not suggest the patient to come and see you once a week. The time is very important for these diseases. Sometimes patients would like to know how many sessions they would need for acupuncture. There's no simple answer to this question, because how many sessions they need will depend on the diseases as well as the individuals. Just in general, acute or simple diseases or symptoms such as the stiff neck, toothache, sometimes can be healed within one session or a few sessions. Some chronic diseases, such as infertilities, stroke rehabilitation, these diseases sometimes may require much longer periods, for a few months, or even sometimes a few years. And some other diseases, sometimes we also treat and continue to treat. We continue for a few sessions more, even after the recovery, just to prevent it happens again. In the clinic, sometimes and actually very often, we will receive the inquiries that they will ask, "Hey, doctor, does acupuncture work on me? Does acupuncture work on my situation?" Sometimes it is very difficult to answer, especially the diseases that's not commonly treated by acupuncture. However, this patient have tried to use different forms of medical services, different forms of treatments. We see no results, no improvements from there. What you can do is you can try for a few sessions, such as 5 to 10 sessions, and see if there's some improvements or not. So this is the general rules that we may consider. In acupuncture and moxibustion prescription, very commonly you will see some symbols, such as these symbols. What does they mean? These symbols indicate the technique that we apply on this patient or on these points. So you need to be familiar with these symbols. For the moxibustion, the moxa stick, sometimes we use the course. Sometimes we also use a rectangle, a long rectangle, so you can write right behind the points. Cupping, you draw a circle. In a prescription, it is very important to keep the prescription simple and clear. So everyone reads your prescription, others will know what points you have been using, what technique you have been using. So when you write the letters, try to write clear, don't write in this kind of style or this kind of style. For the technique, you can write on the side of your points. Large intestine 4, reducing technique on the right side. Or you can write the right side and the technique, one above, one below. So for this prescription, large intestine 4, on the right side, reducing technique. Stomach 36, on both sides, reinforcing technique. Lung 11, on the left side, prick for bleeding. Large intestine 11, on both sides, acupuncture with the moxibustion, one needling technique. Spleen 6, reinforcing technique on both sides, followed by moxibustion, moxa stick. You also can use the cross, the sign. Bladder 23, even manipulation technique followed by cupping. This is just an example of the prescription, so I write it randomly. Normally in one treatment, we will not apply so many different kinds of technique, reducing, reinforcing, prick for bleeding, warm needling, moxibustion, cupping. It's just too complicated. So during one session of the treatment, you try to use the less points, the better. If you can use 1 point, don't use 2. If you can use 2, don't use 3. So keep the prescription simple, and but in the meantime, you need to make sure that's the efficacy of the treatments. The technique, we also try to keep simple, because when you perform too comprehensive technique, the patient doesn't feel good. Also, the results doesn't have to be good. So keep simple from the points, also from the manipulation technique. In this video, we mainly discuss the principles of the prescription, also the layout of a prescription. In the next video, we're going to discuss some clinical applications of the special points. Thank you for your attention.